From allergies to zinc deficiencies, hangry to hay fever, we provide easy-to-absorb information to improve your health. It sounds like health on Texas A&M Health Talk. Howdy, welcome to Sounds Like Health. I am Mary Lee Meyer.
And I'm our co-host, Sam Kraft.
And we are here today with the wonderful Dr. Katie Hepfer. She's a pediatric nurse practitioner with the Texas A&M College of Nursing.
Thanks for having me. I'm excited to be here.
Yeah, we're excited you're here.
Yay.
We're talking about, it's summertime now, so we're talking
yeah.
about the different types of health issues and different things we need to watch out for.
Yeah, I feel like this time of year in the clinic I work in a pediatric clinic, I really kind of ramp up some of my patient education when it comes to summer health topics. The two that come to my mind are water safety and sun safety, both sun and water, things we need in life, but things that can present different hazards. So there's so much to talk about regarding those things, both for children, which is what I emphasize in, but also for adults and teenagers too.
Yeah, absolutely. I know I got pretty beaten up by the sun last week.
I guess I'm just weird. Like, I worry about like West Nile virus and things. Like, sunburns are just, I think that's pretty much a common thing for me. I just accept that it's going to happen to me at some point. But
oh, that's a terrible mindset.
like the bigger, scarier things is what freak me
There
out.
are, and I'm still fairly new to Texas, and there's so much between the West Nile you talked about, Zika.
We're like the Australia of the United
US,
States with all
yeah.
these weird animals and very
The
poisonous
spiders,
things.
the fire ants,
Yes.
the snakes. So
It's terrifying.
yes, it's a jungle out there.
It really is a jungle.
So which one should we talk about first?
Well, I guess something that has been in the news a lot lately is, I guess we can start with sun.
Yeah, the sunscreen.
Yeah.
What is it?
It's like the sunscreen toxicity, like
Yeah, the
too
chemicals
much.
are getting down into your bloodstream or something, and everybody's freaking out about it.
Right. So the Journal of American Medical Association, JAMA, they published a study, I guess, this week showing that some of the 4 main active ingredients that are in commercially available sunblocks have been shown to actually be absorbing into the bloodstream. So what they found is that there is a plasma concentration level if you're following the recommended application guidelines, which is to reapply every 2 hours, use it generously. They're finding that when following those directions, as we should, that there's actually some absorption into the bloodstream, and the plasma concentration levels are higher than the FDA initially recommends. So, of course, there's more information we need there. We need to know, what does this mean for us? Does this mean that sunblocks are unsafe? Well, I don't think so. We know that they prevent things that are scary, like skin cancer, but we really don't know the clinical effect of this sort of thing long term. So I think there's more research that needs to be done there, but just interesting.
Sunscreen's been around for
Forever.
ever,
Yeah.
and this is just now coming to light with this.
Yeah.
So I don't want to dig too far into it. I'm just curious. It's
Yeah.
just because I read the story like 2 days ago.
I mean, I guess it shouldn't be surprising, right? We knew there were chemicals in sunblock. We knew
Sure.
that there had to be something there that can block out sun rays, UVA and UVB rays, and so there has to be something strong there. There are organic sunscreens that people swear by. I've never tried them myself, but I know that there are other options out there that might be safer for children, for adults, and so yeah.
What does this mean for, parents of young children? Does this mean that they should be hesitant about using sunscreen?
I don't think so. I mean, I have 2 young kids, and I'm always trying to keep them healthy and reduce exposure to environmental hazards. But again, we're not at the point where we're saying these are unsafe, they're being taken off the market. What it's just saying is that we know that now that there's some absorption into the bloodstream, and again, we need to look at this longer term to see if that really means anything. I guess if you are worried, you can look for other sunblocks that don't have some of the 4 main chemical ingredients. Oxybenzone is one that is very common. I don't recall the other 3 off the top of my head, but looking for some other brands out there that are more natural that also provide protection against UVA, UVB rays,
Okay.
a broad spectrum sunblock.
So it's nothing to panic about.
Nothing to panic about. There are always these studies going on, which is good. We need these ongoing studies so we can revise what's out there, but I don't think we need to hit a full panic mode.
Well, it's just like it's summer, so let's do sunscreen. But realistically,
Yes.
you use sunscreen all year round.
Right.
I mean, I think that I work outside a lot in the fall, and I take it for granted that it's just not hot. I don't need any sunscreen.
Right.
Wrong.
I mean, 70% of sun rays can come through clouds, and you're right, it's year round. I know on my phone, when you look at the weather, there's a UV index number that you can look for any time of the day, all year long. And we know that 10 and higher, that's very, very strong. 7 and higher is pretty strong. You can burn kind of quickly. 1s and 2s and 3s, you're probably better. And so looking at that before you're going outside to mow the lawn, to play with the kids, no matter what time of year, can be helpful.
So can you get sunburned on a cloudy day?
Absolutely, yeah.
I've heard that sometimes that's actually worse than a full-on sunny day. Does it just depend on the UV index?
Yep, exactly.
Okay.
It depends on the index and what types of rays are coming through. There's some rays that are more burning quality, some that are more the deeper skin cancer producing rays. And so, but general protection is always good. Now, besides sunblock, we tell parents that the best thing you can be doing is just putting your children in shade, staying in the shade as much as you can. Big hats, sunglasses to protect the eyes. You know, they make those wonderful shirts, those rash guards for swim attire that just provide a little bit more protection. So if you really are worried about the sunblock ingredients, then covering up your kids is the best thing you can do.
And what about the different SPFs and waterproof versus water resistant versus, you know, what when we are selecting sunscreen at the store, what should we kind of some general best practices?
Yeah, like why do they make a 30, but they also make a 80?
80.
Like why wouldn't you want the higher one off
Right.
the bat?
So it's interesting. There's actually very little research about if there's any benefit above SPF 50. So we know that you want something at least SPF 15.
Okay.
Below that, you're not really doing
50
much.
or 15?
15,
15,
5.
okay.
But we don't know if anything above 50 does anything different between, so say you're using...
Besides cost $3 more.
Yes, yeah. It says SPF 100. I feel good about that. But
Yeah.
whether or not it does anything more than SPF 50, if you're reapplying and using it as directed, maybe not. So, but definitely getting something at least SPF 15 or higher, we know provides good protection. I tell everyone there's no such thing as waterproof sunblock because it wears off. It absorbs, it wears off, it comes off. Even though it might say it's sweat proof, it's waterproof, it's still important to reapply. It's still important to wait those 15 to 20 minutes, actually 30 minutes ideally, before jumping in a pool after you put on your sunblock. You really need it to start working. Give it time to set in before you start running around and sweating it off.
Along with sunscreen and sunburns and all that stuff, I think one of the biggest things I deal with in the summer is like mosquito bites or bug bites, or, you know, if you're out in the field playing, you know, as a kid growing up, whatever, you know, I guess we called them chiggers. So, you know, go over some of those. What are some of your tips for that kind of stuff? I guess outdoor wilderness or just outdoor in general things that happen to you?
As with most things, prevention is key. And so the more that we can do to avoid those scary things out there, the better. And so bug repellent, bug spray, sort of along the same line as sunscreen. There's so many different ingredients, so many active ingredients, but just finding something that says it helps repel mosquitoes, insects, that sort of thing, making sure people are covered in it before going out to play is important.
Now I'm starting to think about what I'm going to want to do after. You know, I want to find my anti-itch. I want to find some
Ointment, cream, something like that.
Yeah,
Kinda
I need some
make it stop hurting.
some relief, or like the pink lotion.
Yeah.
Right. We talked about prevention, so that's obviously the best step to preventing bug bites, insect stings, but we all know that despite those efforts, it still happens, right? So what do we do once you have a bug bite? Everyone has a little bit of a different tolerance or hypersensitivity to insect stings. Some people are very sensitive to mosquitoes. Some seem to never get bit. So washing off the area, if it is something that, if you're not sure really what you got into, but you know that you're itching and you're seeing a rash forming, washing it off with soap can get any oils off if it is something like poison ivy rather than like an insect sting or bite, is always good. Washing the area also helps prevent infection down the road. And then applying an antihistamine type cream, a steroid cream, anything like that to help bring down the hypersensitivity response.
And poison ivy can get on your clothes too.
Oh, yeah.
So it's the oils that can get on your clothes and then later you rub up against or it gets on your skin. And again, some people are sensitive to it, some aren't. And so washing off the area with soap to get those oils off is how you can help minimize.
I had a really bad poison ivy one time, and it actually burned my skin. It was weird. I used to like itchy, scratchy red bumps, but it actually like almost looked like a chemical burn. I thought that was really weird. Is that common?
Yeah, it can be. You must just be very sensitive to it.
I guess poison oak as well.
Or poison oak, yeah.
Either one.
There are a lot of things, and we don't always know what it is that we got into or what got us until a little bit down the road when we start to itch a little bit. So things to look out for is if it's starting to look infected, if it's becoming a burn type situation where more layers of the skin are involved. A cellulitis is when the infection is spreading to the bloodstream and surrounding tissue. That would be reason to seek to see a medical provider in case you need something systemic like steroids, antibiotics, that sort of thing.
But in the meantime, you'd think just antihistamine or...
Don't scratch it.
Don't scratch it.
Don't
I
scratch
tell
it.
people, and there's
man.
a lot of wonderful things over the counter for anti-itch, that pink cream that our moms put on us when we had itchies and that kind of stuff.
Most people, you have that kind of stuff around the house, I think. What about your clothes? Talking about bug bites and that kind of stuff, is there anything you can kind of prepare yourself, like, you're going to be outside in the summer, in the evenings, when mosquitoes are pretty prevalent, or you're in that kind of area? Can you prepare your clothes? And can you spray your clothes down with anti-bug stuff? Or is that real effective?
Yeah, definitely. Spraying with bug spray. They actually make specific clothes spray.
Oh,
Part of
I
it
didn't
could
know
be
that.
a marketing ploy. It's really just the same, but it's applying
Still.
those active anti-insect ingredients to clothing.
Okay.
They like those areas that are exposed, but they can also get into the clothes, around the clothes, making sure you're remembering neck. I always say if you don't want to be spraying an aerosol on your face, spray into your hands, rub, then apply to your ears, your neck, your cheeks, that sort of thing.
That's a good idea. I've never thought about that.
Yeah.
And we always had in our backyard like those tiki torches.
Yeah.
That put out the...
We always had bug zappers. Zap.
Citronella
Zap.
candles. Yeah.
Bug zappers way more
The sound
fun.
of summer. Yeah.
Yeah.
And does that stuff have DEET? What's the word DEET that I've heard before?
So DEET is the active chemical ingredient in insect repellent. Things like citronella, candles, that's something different. A different aroma that sort of wards off insects. And there are a lot of natural things too for those people who are more into the natural products. Things like vanilla and I can't remember some of the other more natural smells that insects just don't like. It kind of repels them. So if you're really opposed to using the stronger chemical things, if you're not going to be in the deep woods and you're just kind of just sitting out on a screened-in porch, you can use something that has some of those more pleasant smells that are just natural repellents.
Another outdoor thing in the summer is pool safety, water safety. Can you speak a little bit about that?
Sure. Water safety is such an important topic. I emphasize it at all of my well child checkups, especially heading into the summer. It is the leading cause. We know that it's the leading cause of injury-related death in children. And beyond toddlers and young kids, it's also a big hazard for teenagers. They're less risk adverse. They sometimes have alcohol, drugs involved. And so it's really toddlers and teens that I'm focusing on. So drowning isn't always what we think it is. And that's what I tell families. It's not always the times we're at the pool and we're thinking about drowning. It's those times when we're not thinking about drowning when it can become something serious and scary. Drowning is, it can be silent. It's not always what we think it is. It's not a kid splashing around in the pool. It's those 2 seconds that you turn your head and a child wanders off into... It could be a pool, could be a retention pond. I have one near my house. I have 2 young kids, like I said. It's always in the back of my mind. Storm drains, buckets, toilets, bathtubs. You say, I'll be right back. I'm going to go grab a towel. And it only takes a few seconds. So drowning, it's rare, but it happens. And the thing about it is it's deadly. I mean, there's no in between. It's either not happening or it happens in a split second. And so it's that intensity behind the conversation that I really try and emphasize with families, that there needs to be someone always keeping eyes on small children, especially because it can happen that quickly. No one is immune.
And is it like you can drown in 2 inches of water?
2 inches of water. Yep, 1 to 2 inches.
1 to 2 inches.
It just
Wow.
takes enough, for a child to flip over and their nose to be submerged, their face to be submerged. It could happen after a head injury. Someone falls, or a child has a seizure. and
Well, being that little, they don't know
don't
to breathe in, or
Right.
I have a 3-year-old that freaks me out every time. Like the bath, it's just.
And it's good. It should. I tell people it should
me.
scare you. It
Yeah.
should freak you out to think about. And yeah, there just needs to be someone having their eyes on someone at all times.
Sure.
So I don't know if with your 3-year-old, if you ever have looked into the infant survival swim that
No,
they
I
have
haven't.
now. And so there's a new program. It's not new, but it's becoming more popular, more well-known. Infant survival swim or infant rescue swim. And it's basically the idea that we can teach kids through sensory motor learning from a young age, 6 months and older, how to survive if they were to fall in a body of water. And the principle behind it is just training them to flip over onto their backs so they can float. So I think it's a really good thing.
Yeah,
if you
for
can find a
sure.
program like that
Sure.
in town. The American Academy of Pediatrics, they've been back and forth about, there's been a lot of changes about their recommendation for swimming lessons. It used to be ages 4 and older. The thinking was maybe that until you're that age, you can't really learn how to swim. And beyond that, if a child is younger taking swim, the thinking was that it might give parents, guardians a false sense of security. Like, oh, my kid has taken swim lessons.
100%.
They know
yeah.
what they're doing. And we found that the data kind of showed that, well, actually, any age of swim lessons is beneficial. It can help prevent drowning. Now, we never want a false sense of security no matter what. There should never be a sense of security when it comes to water.
That's why grown people drown all the time in lakes. They think that they go out there. Oh, he was a strong swimmer, and he tried to swim across the lake, and you get out there halfway, and you don't realize how far you are, and
How exhausting it can be.
Yeah, maybe you get a cramp, or you just give out, and you just go under.
Right.
And people should try and teach their kids to swim even if they're not around that much water, because like you said, it can just it happens when you're not thinking about
Right.
it.
When
In
you're
the bathtub, turnover.
bathtub or at a neighbor's
Something that
house
little.
and they might have a pool. It's those times when we're not as vigilant about watching our kids. I was playing with my toddler at our neighbor's house. They have a pool. We don't. And I talk to my daughter, who's 2.5, all the time about, you never go in water without mommy. You never do this. But she's still a toddler. She's still impulsive. And we were playing in the driveway, and I turned around for a second to talk to my neighbor, and she had gone around the back to grab a toy with the 6-year-old, and the pool is back there. And I had this moment where I'm like, she could have just run into the pool. And I ran after her. And I guess what I'm saying is no one is immune. I'm a nurse practitioner. Like, this is what I do and talk about all the time. But I still find myself in those moments, like those scary moments where that could have been us. So.
And what about the rumor about you have to wait 4 hours after you eat or you'll cramp? Is that
4 hours.
Is there?
I thought
Wasn't
it was like 15 minutes.
This is something I feel like all of our parents told us. They
Yes.
instilled
They
this
all
fear,
did.
like, oh, you ate a bowl of cereal, you
Yep.
cannot go swimming.
Nope.
I don't know if there's anything medical behind that. I think it's just important to give our kids breaks, and so that they're not getting tired, and so that the risk of drowning goes down. I don't actually think there's anything physiological to that. I think it's just a way for people to take a break, which is a good thing. Put on sunscreen, digest a little bit, go to the bathroom, and
let's chat a little bit about dry drowning, since we're talking about water safety and everything in that area.
yeah, so dry drowning is something that's been kind of in the news again, in the media lately, something we heard about last summer, the scary notion that your kid could be swimming, they go underwater, they might have taken on more water than we realized, and later that day, parents have reported finding their children dead, not waking up from a nap. And I guess there's some misconceptions behind dry drowning that maybe I want to mention. For one, it's not this thing where something has happened in a pool, your child's been underwater, they've shown no signs of any medical harm, and then all of a sudden something happens to them. What really dry drowning is just that a long-lasting effect from taking on too much water. A child will always show signs of nearly drowning. They'll have some coughing, some lung damage. Maybe they've been taken to the hospital. And so I guess what I want parents to know is they don't need to be scared about their children going underwater. They don't need to be scared about them swimming, looking to be totally fine, and then something happening. What we see with dry drowning isn't what it's been portrayed in the news. A child will have been harmed in some way, and what dry drowning is just lasting inflammation in the lungs from near drowning, I guess.
Yeah, the news makes it sound like it's just they were fine 1 minute and they were gone the next.
Exactly.
Like you'll see something. There's
You'll
some
see
symptoms
something.
of something.
Your child should nearly drowned, and so maybe they needed CPR, maybe they needed to be rescued.
So there's still an incident.
There was an incident,
Yeah.
a specific incident
Okay.
that occurred, and it was a close call. And what it's just trying to portray is that, yes, drowning in the moment can be severe, and if they've nearly drowned, it still needs to be brought to medical attention. A child should still seek emergency medical care to make sure that there hasn't been too much water into the lungs, too much inflammation in the lungs from that. And so, yeah, it's not something that your kid will be acting fine and then later
Well,
that
they
day
make it sound
something
like
happens.
SIDS, where it's just this
Yes.
random thing that just out of the blue happens.
Right.
It's not like that. It
No,
sounds like.
yeah. It's not like that. And
Yeah.
so people have been scared to have their children go underwater because of it. And so I think that's where it's been a little bit confusing in the media.
Yeah, that helps a lot.
Mm-hmm. And you would think if your child almost drowned, you would call some sort of
You would know.
healthcare provider, like, and there would be some sort of
Right.
Well, at that point, you would hope the EMTs
Proactive
that were there. I mean, if your kid almost
yeah.
drowned, there's probably emergency
Right.
medical personnel will show up and.
yeah.
I think
And
that's
go
the
through
important
the
part, that
things.
just because a child survived a near drowning incident doesn't mean that they're in the clear. There is
Sure.
a few hours later where it could still be critical, and so a child should seek.
Well, in the healthcare world, does that become more of a thing with y'all being more, hey, this just happened, we really need to do some more tests or whatever? Do you think that's becoming more of a thing?
Probably some more investigation into when is that critical period. When are you in the clear after a near drowning episode? And I keep saying children, but I do want to stress that there are many adults out there who don't know how to swim, or who do know how to swim and still find themselves in these near drowning type situations. So it goes for everyone.
It's not just kids that should be worried about dry drowning, like adults, same thing.
Right. We know that taking on too much water, not getting air, not that sort of thing,
Sure.
is harmful to anyone. And so there are a few hours, even if you survive the incident, there is some time afterwards where you could have some lasting effects, and getting that checked out.
What about hydration on hot days and being out in the heat, and be mindful of what you're absorbing in the sun and what you're taking in and sweating out? I think dehydration is a huge thing. A lot of people don't realize that they experience.
Right. Yeah, it's definitely something, especially in our area with the heat, and especially playing in water. Sometimes we don't realize how hot we are because our body temperature feels like it's staying cool.
and we don't feel ourselves sweating.
Right. We don't feel ourselves
Yeah.
sweating. And so staying hydrated is so important. Reminding, kids don't think to drink. They're out
Yeah,
playing.
they
and so
just never think about it.
they never think about it.
And what are some signs that you can see that your child's getting dehydrated? Their cheeks start to flush. What should parents be on the lookout for?
Yeah, cheeks flushing, just that panting sort of open mouth, they're just looking a little tired. For older kids, it's easier for them to say that they don't feel good. Sometimes they'll start with a cramp, a stomach ache, feeling a little dizzy or a little woozy. I've even seen athletes, just seem disoriented almost. And that means we're getting to the point of concern that they need to step out, get to a shady area, remove layers of clothing, hydrate, cool packs, whatever you need to do to bring the body temperature down.
Because people can pass out, right?
Yeah.
And some people throw up if they get too hot?
Right. Yeah. Some people have like a visceral type stomach, abdominal response to heat. And again, that's a point where we're at a point of concern where it can be severe.
What about heat strokes? Since we're kind of in that area of things, what are the symptoms of heat stroke or just getting too hot?
Yeah. So with heat, there's sort of varying degrees. We have heat exhaustion, heat illness, you might hear. Being overheated is probably the first step. We've all been there. Heat exhaustion is a little different. Heat stroke is that's the point of
Most
severity.
serious.
Yeah, that's a serious medical concern where
Okay.
your body temperature is so high that we're having potentially organ damage and orientation where you're passing out.
So the first two would probably be more of everyday kind
The
of
goal
living.
is to stop it once you're feeling overheated, so that you don't get to the point of a heat stroke, which is your
Now,
blood
is that
pressure.
just being hot and sweaty,
Yeah.
or is it? I mean, do you get dizzy and that kind of stuff? Is it all the same kind of things?
All the same, yes. But I always tell people if they are feeling dizzy, if you're having a hard time focusing, concentrating, then that's when you need to back off.
Like, just take a break.
Yeah.
relax.
Yeah, I don't think I realized that there was a difference between heat stroke and heat exhaustion. I
Yeah.
feel like I used them interchangeably.
And a lot of times we do, because it's a fine line. It can progress so quickly, and so especially in younger kids when their body surface areas smaller, and so yeah, it's all all related, all concerning. Athletes are, something you hear about a lot in the news. Football players, because they're out in the heat that time of year. Yeah. And they're wearing a lot of clothes. And so they're not sweating and emitting that heat the way people are when they're out in a tank top. And so that's when you hear about players going down or even dying. So
Yeah.
I mean, it feels like it's been 1 or 2 a year for the last 10 years. It's terrifying.
it is terrifying.
Yeah, and when I was in sports, there was almost somewhat of a stigma about taking a water break when the team wasn't taking a water break. It was
for
kind
sure.
of hard to be like, no, I need to stop. I can't continue and take a little water break.
Mine was always, are you hurt or are you injured? I mean, it's, our water breaks consisted of a PVC pipe with holes drilled into it. And then it's, with where we've come 20 years ago to full circle to today, and how people are so much more, I guess, just knowledgeable about your bodies and what heat does and how important it is to keep hydrated. I think it's, schools have gone a long way to preventing that kind of stuff nowadays.
And I feel like stories like that are making people more aware and making coaches and teachers and even, peers, different students.
Yeah, a kid being thirsty, it really just might not be him being a slacker. He really might need medical help.
Right. I hope the perception is changing, and that there have been some changes about that, about keeping athletes hydrated. I tell a lot of my intense athletes, eat a banana before practice. Banana has everything you kind of need in one. It's not so much just the hydration, it's having enough calories, and so you're keeping your blood sugar up. That's important as well. It's all related.
Yeah, you're absolutely right. It's also related. It's why I'm glad we can do these types of shows. And I'm glad you're able to come over today.
Yeah, thanks for having me.
Yeah, it's been fun. Thank you. And thank
Happy summer.
everyone for listening. This has been another episode of Sounds Like Health.
Thank you for joining us on Texas A&M Health Talk, a production of the Texas A&M University Health Science Center. Visit us on the web at vitalrecord.tamhsc.edu, where you'll find answers to all of your health questions. Until next time, stay healthy.